8 Isolation exercises you need to stop doing after age 50. We've always emphasized the power of compound exercises for hypertrophy, strength gains, and anabolic responses, and for good reason. They are fundamental to an effective training program. However, isolation exercises also play a crucial role in maximizing muscle development. It's no coincidence that they're present in virtually all weightlifting programs, whether for beginners or advanced trainees. However, a critical aspect needs to be considered. After age 40, our bodies undergo significant changes. Bone density begins to decrease, tendons and ligaments lose elasticity, and susceptibility to injuries increases. Therefore, when choosing an exercise, we need to consider a determining factor: safety. That's why in this video, you'll see 8 isolation exercises you need to replace if they're currently in your workout routine. And just to be clear, I'm not saying you need to completely stop doing these exercises. I'm suggesting that to ensure your longevity in weightlifting practice, there are alternatives that will stimulate exactly the same muscles but with greater safety. Before we begin, please leave in the comments your name and the city from where you're watching our content. Exercise number 8, front raises. Front raises are a classic exercise for developing the anterior deltoid, the front portion of the shoulder. Many practitioners include this movement in their routine seeking those round, well-defined shoulders. However, this is one of the first exercises that deserves reassessment after age 40. When we perform front raises, especially with heavier weights, we place significant tension on the shoulder joint, particularly in the rotator cuff region. This area is naturally vulnerable due to its anatomical complexity. We have 4 smaller muscles that stabilize the shoulder joint, and they tend to wear down over time. The main problem with front raises is the pinching mechanism that can occur as we raise our arms frontally, especially if the technique isn't perfect. The supraspinatus tendon can become compressed between the humerus and the acromion, a bony extension of the scapula. This repetitive compression, known as impingement syndrome, can cause inflammation, pain, and eventually tears in the tendon. Studies published in the Journal of Shoulder and Elbow Surgery demonstrate that approximately 25% of people over 40 already show some degree of rotator cuff wear even without obvious symptoms. Adding an exercise that intensifies this wear is, at minimum, risky. Additionally, we need to consider a truth that many ignore: the anterior deltoid already receives significant stimulation in virtually all chest exercises. Bench press, flies, push-ups all work this portion of the shoulder considerably. Therefore, adding front raises can represent excessive stimulation for an already well-worked area. Safer alternative: lateral raises. This movement works the lateral deltoid, a frequently neglected portion that significantly contributes to the appearance of wide, athletic shoulders. Lateral raises, when performed with appropriate technique and moderate weight, exert much less pressure on the rotator cuff. Exercise 7, Triceps Kickbacks. The triceps kickback, or dumbbell triceps extension behind the head, is extremely popular in gyms. It offers an excellent contraction of the triceps, especially the long head, and many consider it essential for developing the back of the arm. However, this exercise can be particularly problematic after age 40. The shoulder position during the triceps kickback places the joint in extreme external rotation and flexion, while the elbow performs repetitive flexion and extension movements under load. This combination creates an ideal scenario for injuries in 2 joints simultaneously. In the shoulder, this extreme position can cause stretching of the posterior joint capsule and press the biceps tendon against the acromion. A study published in the American Journal of Sports Medicine demonstrated that this risk position increases the chance of glenoid labrum injury by up to 3.4 times. The glenoid labrum is a cartilaginous structure that helps stabilize the shoulder joint. As for the elbow, repetitive extension under load places significant stress on the triceps and its insertion at the olecranon. After age 40, when tendons lose elasticity and recovery capacity, this constant stress can lead to triceps tendinitis, a painful condition that's difficult to treat. Safer alternative: cable triceps extension. This exercise allows you to work the muscle just as effectively but with much less joint stress. The main advantage is that you can adjust the elbow angle and body position to find a comfortable configuration that doesn't force your joints. Electromyography research shows that muscle activation in cable triceps extensions is comparable to that of traditional triceps kickbacks, while the risk of injury is significantly reduced. If you still prefer the triceps movement with the arm elevated, a safer option is to perform the exercise supported on an inclined bench, which provides support for the spine and allows you to keep your shoulders in a more neutral position. Exercise 6, Dumbbell Flies. Dumbbell flies are a classic exercise for chest development, especially for emphasizing the outer chest. It's a movement that provides an excellent sensation of stretching and contraction, making it popular among practitioners of all levels. The main problem with dumbbell flies lies in the vulnerable position in which it places the shoulder joint during the stretching phase. When the arms are open and the dumbbells are at their lowest point, extreme external rotation of the shoulder occurs, combined with horizontal adduction. This position places enormous tension on the anterior shoulder capsule and rotator cuff tendons. A study published in the Journal of Strength and Conditioning Research demonstrated that during dumbbell flies, electrical activity in the subscapularis muscle, one of the main shoulder stabilizers, increases significantly, indicating excessive work of this stabilizer. After age 40, when these stabilizing muscles no longer respond as before, this excess work can lead to premature fatigue and decreased joint protection. As we explained, age brings changes in the composition and elasticity of connective tissues. Tendons and ligaments become less elastic and more susceptible to injuries from excessive stretching, exactly what happens during the point of greatest amplitude in dumbbell flies. Best alternative, machine fly. This equipment provides several significant advantages for practitioners over 40. First, the movement trajectory is guided, drastically reducing the risk of incorrect movements that could injure the shoulder. Additionally, there's no risk of losing control of the weights as can happen with free dumbbells. Exercise 5, Seated Calf Raises. Developing the gastrocnemius and soleus, the main calf muscles, many included in their routine to add size and definition to this area that's so difficult to develop. However, the biggest problem with seated calf raises is the compressive load they place on the knees. In this exercise, weight is applied directly to the knees through the upper thighs. After age 40, articular cartilage naturally begins to wear down, making the knees more susceptible to compression injuries. A study published in the American Journal of Sports Medicine analyzed intra-articular pressure in the knee during different leg exercises and found that seated calf raises produce significantly higher pressure peaks compared to the standing version. This increased pressure, repeated set after set, can accelerate the wear of articular cartilage. Additionally, the seated position with bent knees places additional tension on the menisci, crescent-shaped cartilaginous structures that act as shock absorbers in the knee. The safer and more effective alternative is standing calf raises. In the standing version, weight is supported by the skeletal structure as a whole, passing through the ankles, knees, and hips in an aligned position. This more balanced distribution of the load reduces the risk of joint injuries, especially in the knees. Electromyography studies show that while the seated version works the soleus more, standing raises more effectively activate the gastrocnemius, the muscle that contributes most to the voluminous appearance of the calf. Since most people are precisely seeking this volume, the standing version ends up being not only safer but also more efficient for aesthetics. Exercise 4, Concentration Curls with Dumbbells. The concentration curl with dumbbells is a classic exercise for biceps isolation, popularized by bodybuilders like Arnold Schwarzenegger. In this movement, the practitioner sits on a bench, supports the arm on the inner thigh, and performs elbow flexion with a dumbbell. The main risk of the concentration curl is the extremely supinated position of the wrist combined with complete elbow flexion. A study published in the Journal of Biomechanics analyzed the forces on the biceps tendon during different curl variations and discovered that the concentration curl generated significantly higher tension peaks compared to other variations. This increased tension, especially when using substantial loads, can predispose to microlesions in the tendon that, over time, can evolve into more serious conditions. Additionally, the seated position with the trunk bent forward and twisted to support the arm on the thigh places the lumbar spine in a vulnerable position. This posture, maintained for several repetitions and sets, can exacerbate pre-existing lumbar problems common in people over 40. The safer and more efficient alternative is to opt for bilateral movements that allow the use of heavier weights, such as straight bar curls or easy bar curls. The ability to use heavier weights provides a more significant anabolic stimulus fundamental for combating sarcopenia. The easy bar, with its slightly angled grip, places the wrists in a more natural semi-supinated position, reducing stress on the radial joints and biceps tendons. This more neutral configuration is particularly beneficial for people with a history of forearm or elbow discomfort. Exercise 3, Traditional Sit-Ups. Traditional sit-ups are probably one of the oldest and most widespread exercises in the fitness universe. It consists of lying on your back with knees bent and raising the trunk toward the legs. Despite its popularity, the problem with traditional sit-ups is the excessive pressure they exert on the lumbar spine. During the movement, especially when executed quickly or with fixed feet, significant compressive force occurs on the lumbar intervertebral discs. A study published by the University of Waterloo, conducted by Dr. Stuart McGill, a specialist in spine biomechanics, demonstrated that each repetition of traditional sit-ups imposes about 3,300 newtons of compressive force on the lumbar spine, equivalent to 748 pounds of pressure. After age 40, the intervertebral discs naturally begin to lose hydration and elasticity, becoming less capable of absorbing and distributing these compressive forces. This natural degradation, combined with the repetitive stress of traditional sit-ups, can accelerate disc wear and significantly increase the risk of hernias and protrusions. Additionally, many people unconsciously pull their neck during traditional sit-ups, placing excessive tension on the cervical spine. This tension can exacerbate problems such as cervical spondylosis and chronic muscle tension, conditions that become more prevalent with advancing age. The safer and more efficient alternative is planks, in their various variations. Planks work not just the rectus abdominis muscles but the entire core, including the obliques, transverse abdominis, and spinal erectors. And they do so in a position that maintains the spine in neutral alignment. A study published in the Journal of Strength and Conditioning Research compared muscle activation during different abdominal exercises and found that planks produce comparable levels of activation in the rectus abdominis to traditional sit-ups but with significantly less stress on the lumbar spine. Exercise 2, Sven Press. The Sven Press is an isolation exercise for the chest in which the practitioner presses one or two weight plates between the palms of the hands and extends the arms in front of the body. Although effective for creating constant tension in the pectorals, the main problem with the Sven Press is the uncomfortable position of the wrist and shoulder joints during the exercise. The wrists are forced to remain in extension while applying constant pressure to hold the discs. This non-anatomical position, maintained under tension, can exacerbate conditions such as carpal tunnel syndrome and wrist flexor tendinitis. Additionally, the extreme horizontal adduction of the shoulders, combined with the internal rotation necessary to keep the palms pressed together, can compress delicate structures in the shoulder, such as the subacromial bursa and rotator cuff tendons. A study published in the Journal of Orthopedic and Sports Physical Therapy demonstrated that combined positions of horizontal adduction and internal rotation of the shoulder significantly increase intra-articular pressure and the risk of subacromial impingement. The Sven Press also presents significant practical limitations. It's difficult to progress in terms of load. You can add more discs, but this makes the exercise increasingly awkward, and the intensity of muscle stimulation is relatively low compared to other chest exercises. The safer and more effective alternatives are the traditional dumbbell bench press or the machine bench press. The dumbbell bench press allows each arm to move independently, finding the most natural and comfortable trajectory for your specific joints. You can adjust the angle of the wrists as needed to minimize discomfort, something impossible in the Sven Press. Exercise 1, Sven Press. The main problem with side bends is the asymmetric compression they cause on the spine, especially in the lumbar region. During the movement, the intervertebral discs suffer uneven pressure, being compressed on one side and extended on the other. When discs naturally begin to lose hydration and elasticity, this asymmetric stress can accelerate disc degeneration and increase the risk of hernias. Additionally, many people tend to perform the movement incorrectly, compensating with trunk rotation or excessive lumbar extension. These compensations further increase stress on vulnerable spine structures such as the facet joints and intervertebral ligaments. A much safer and equally effective alternative is the exercise known as captain's chair leg raise. In this exercise, you position yourself with your forearms supported on the pads of a specific station, with your back against a backrest, and raise your legs laterally. The great advantage of this exercise is that it keeps the spine in a neutral position throughout the movement, eliminating the risk of asymmetric compression of the intervertebral discs. The work is performed by the obliques as they stabilize the trunk and control leg movement without subjecting the spine to unnecessary stresses. When performing this exercise, keep your back firmly supported against the backrest, avoid swinging the body to generate momentum, and concentrate on using the obliques to control the movement. If you enjoyed this and other isolation exercises and want to discover machines that can cause injuries after age 40, we've left a video appearing right now on the screen where we show the most harmful ones to your body. Thank you for watching until here, and may God bless you, my friend.